Welcome, Owen, and thank you for taking the time to meet with me to reflect on PCI College as we are in our 30th year as a training provider in mental health and counselling and psychotherapy. And of course, it would be remiss to not include you in that discussion, given your history and contribution to not just the college, but to the broader field of counselling and psychotherapy as well. So Eoin Stephens, I'm delighted to have you here today, and I'll hand over to you to introduce yourself and tell us a little bit about your background and history, if that's okay.
Great, thanks, Jade. Yeah, it's amazing that it's 30 years of PCI College. And I suppose, I'll start by introducing myself by maybe starting with my involvement in PCI College. So, for a period starting in 2004, I was involved in leading the college. Initially, administrative director, I think, was my title, and eventually college president. But that was just one of the turning points in PCI College's history, in the sense that Liam and Josephine, the founders, had decided, that they wanted to step back a little bit from the next phase of growth, stay involved in the college, but not be so responsible for the next phase of growth. So they brought in a board and myself then to help with the running of it. But I'd been lecturing for them for a couple of years before then. Actually, that's how we knew each other. I'd already been lecturing in certain topics, which means that it's close on 20 years, my own involvement as of this year. I think it must have been 2002. So close on 20 years total involvement. Last, whatever it is now, 5 years, I've been back in the lecturing role. And so in between, I think it's 11 years very, very involved in the heart of PCI College's growth, obviously. So that's the main piece for me to talk about today, 2004 to 2015 or so. And other than that, my background, I'm in the counselling and psychotherapy field for a lot for longer than 30 years. I don't think I won't start counting it now. As an addiction counsellor, as lecturer, as somebody doing a variety of private practice, probably known for addiction work, particularly things like behavioural addictions, like sex addiction. Involved in cognitive behavioural therapy, quite a lot, as been one of my, again, contributions to PCI College. And currently moving very much in the direction of working with the area of adult autism. It's an emerging area. A lot of people, a lot of children being identified as autistic these days, compared to the way it used to be, and getting early help, early support, early adaptation, at least hopefully. But of course, some of the fallout from that is the huge number of adults who are realizing that they are or may be autistic, including myself, have that realization a number of years back now. And so, for professional and personal reasons, I'm devoting more and more of my time to the implications of that. What does it mean to be autistic, and what does it mean to be autistic if you're coming for counselling for the usual reasons? People come for counselling for anxiety, depression, relationship issues, addictions, and so on. But obviously, to be autistic then just has some implications, and then some interesting questions about what it means to be an autistic therapist, which are only beginning to unfold, I think, not just for me, but for some other people in Ireland. And I'm making links around the world, again, emerging question: what does it mean to be an autistic therapist or an autistic student therapist? So I think some interesting questions there for all of us to explore going forward. So that's me.
Yeah, absolutely. It's such an interesting and important emerging area, and so kind of true to your authentic self as well, Owen. So I've no surprise as to how and why your energies are pulling you in that direction, and delighted that you're the one kind of leading the field in that regard. It's interesting hearing you reflect on PCI and the formative years that you were at the helm, if you like, and all of the amazing input and contributions that you brought to the college, and the elevation of standards when, you know, the profession itself was beginning to elevate its standards, and then you brought the college in line with that, which is a huge legacy to leave the college with. And it's, you know, it's still climbing in that direction, but that was very much started by yourself, Eoin. So, you know, what do you regard as your kind of standout contribution or legacy within the college? I can name a few, but I'd love to hear from you.
Well, there's in various bits and pieces, and I suppose it does depend on like who you ask, possibly. But I mean, for me, it's professionalization. That is the word I was thinking about before this, before, you know, our chat. And you know, you've touched on the word there, profession and professional, a couple of times. The whole issue of professionalization in our field is very interesting, because I've, you know, had a good bit of involvement with IACP committees over the years, as you know, as you have yourself now. And I remember, I don't know quite when it was. I'd say it was probably, like, it was before my PCI time, so late 90s, I would say. I remember a meeting, you know, kind of, you know, a large number of people from a variety of backgrounds in the field to talk about visions for the counselling psychotherapy field. And I remember at that time, like, I mean, it wasn't just true of that meeting, but it's just that this meeting crystallized it in my mind. At that time, the notion of professionalization was actually very controversial. As in, for some people, including myself, it was the obvious direction we needed to be going. We needed to stand as a profession with other helping professions. And for other people, to my surprise, it was quite a negative word, a word with negative connotations. They didn't think that counselling and psychotherapy should be a field that professionalizes and is like other professions. I think there's traces of that thinking still around. I don't think it's gone, but I don't agree with it. I think the field needs to be a profession, whatever that means, and maybe that's something for us to say a few things about. But I do see huge change. Yeah, I think it would have been part of my vision. It would have been part of my vision for the field, part of my vision for the IACP, along with plenty of other people, part of my vision there for PCI College. And yes, when I came on board, that was very much how Liam and Josephine saw it as well. Again, just felt they needed some help with the growth in that area. But after all, where we are now, I think I see a few things for PCI College, for the field, but also, you know, very much led by PCI College amongst others. First of all, I think that there's a much stronger sense in the field and amongst, say, you know, our large number of graduates, but also, you know, lots of others in the field now, that there needs to be a continued fight for professionalization and professional recognition. I think a year of COVID has actually heightened that in a lot of people's minds, which is a very interesting discussion. I think that the notion that, and again, this has been controversial, the notion that degree standard minimum is what's needed for our profession is now becoming pretty much commonly agreed and accepted. And of course, PCI College, Liam and Josie in particular, were leaders in that area, because, you know, they were in touch with Middlesex University there in the, you know, in the late 90s or whenever it was, you know, and very much led that charge. So that's a very interesting piece. And just the other interesting piece to throw into the mix, I'm sure you're well aware, but I don't know what the statistics here or whether there's anyone's done actual research on it, but the average age of counsellors and psychotherapists has very much gone down gradually over the years I've been involved in the field. And I think that's there. A lot of those younger therapists also are leading that charge. This is a profession. This is my job. This is my career. You know, I expect to be seen, you know, and treated as other professionals are treated. Now, I think there's another meaning to professionalization, which is about, as you say, internal standards, how we do our work and how we judge our work. It's also that external piece of how our profession is seen.
Yeah, that's really interesting. And I actually recall, God, many years ago now, being at an IACP event with yourself where this very topic came up, you know, of the age limit into the profession. And you very much being an advocate for equality in that regard, and the value of life experience, and not over age experience, if you like. And that was important for me as a young emerging professional at the time as well. And you very much, handed those reins over to me, of which I'm very, very grateful for. But without that forward thinking, that wouldn't be possible.
There you go.
And also, you mentioned about the professionalization and the standards and the advocacy that you adopted all through your career, but that was so evident in your presidency, with regards to the degree program being a standard of the college well before it was a standard of the profession. And then also under your presidency, you introduced master's specializations within the college, which again elevates that standard, that recognition for not just a qualification, but in fact, if you're actually going to be working within a certain client group, you need a higher standard of education around that area. And I think that's very much part of your legacy in the college as well.
And as we do this reflection, I'm not going to single out much in the line of individuals. I think it would be a bad idea, in terms of say memories or gratitude or acknowledgement. I've worked with lots of fantastic people in the years in PCI College. I've learned a lot. You learn a lot by lecturing, for a start. I learned an awful lot about trying to run an organization. I learned a huge amount about the academic field, as you have yourself in the kind of role you're in. And bar certain individuals like Liam and Josephine and Martin Kitterick, who I want to mention at some stage. Other than that, I don't want to mention too many individuals, because then where do you stop? But what I do want to mention is Middlesex University.
Yeah.
Because I think, however Liam and Josephine made that choice, I think they made a good choice. I think we've had a very good relationship with Middlesex University. Like every relationship, it has its tense moments, but and difficulties that have to be solved. But by and large, what was being looked for there was a partner who could help us raise academic standards. And I think Middlesex University do that very well. They're very serious about academic standards, naturally, at the university, but also, very, open to the application of that in the field of counselling and psychotherapy. So I think we've always had good, sometimes difficult, but productive discussions over the years with Middlesex. And I think this is one of the key points, that one of the things that comes with professionalisation that isn't always welcome is academic standards. Our field initially wasn't a very academic field, and academia is not what it's all about. And nobody, I think, really claims that simply getting a degree automatically means you're a great counsellor. Of course, other things shouldn't be lost. Of course, our the content of the training and the process of assessment and so on is based on more than academics. But that doesn't mean it isn't important. I think, you're asking me for my experience and my thoughts, and me as a person, and you're talking about what I brought. Well, certainly I brought that, and people aren't always mad about that. Lecturers aren't always mad about it. Students certainly aren't always mad about it. Nobody loves an essay except for that occasional student that everybody else hates because they love essays. But we've just got to do them. It's the way the world works. Partly because in the end of it all, if you want to really understand your field, you've got to read, and what forces you to read is having to write an essay. But also because it's just it's about credibility. Whether that's right or wrong, there's a credibility factor there. So yes, I would certainly think a big part of my experience was that academic push, started by Liam and Josephine, but still that academic push. Come on, folks, let's just meet that standard and meet it well, all of us. From the people leading the college, to the lecturing team, to the student body, and filtering out into the field. And many have followed since, and a few other colleges were similarly getting started in that area. But PCI College was very much at the leading edge of that academic push, which has turned out, if you like, to be kind of prophetically accurate. Here we are with, Coru looking at the situation of statutory regulation and registration, and surprise, surprise, we're talking about minimum, degree standard. ICP have, now come on board around that. And yeah, as you said, even master's degrees are becoming, a kind of an accepted thing that people need and want in our field. And yeah, we had a very interesting time, a number of years back, pushing ourselves further into that postgraduate area. So yeah, that is one really important theme, isn't it?
It really is. And I'm so glad that you were, you named that so excellently there. Our relationship with Middlesex has grown and grown and grown, and it has allowed us to maintain our integrity from an academic perspective, which also then helps us maintain our integrity from a professional perspective, but also has kept us that one step ahead of standards up till now, and continuing, if you like. So that is something the college are really, really proud of, and the good relationships that have been forged with Middlesex over the years and throughout your leadership and beyond, they continue, and we envision that continuing as well. So it's fantastic for our students and for the profession for us to be so closely affiliated with a recognized university. And so that's really well said, I think. Something else I just want to tip in on, you mentioned Martin Kitterick. Tell us about Martin.
Well, I mean, I suppose, one of the things I'm here to talk about is memories. And obviously, very important memories that I have of my time with PCI College is two great losses. Is the loss of Liam McCarthy and also the loss of Martin Kitterick. So they're two people, very essential people I was very close to, as colleagues, worked very closely with, who passed away during the time I was with PCI College. And well, it was a little bit more timely for Liam, I suppose, in the sense that his health there's always been struggles with his health. It was much more of a shock with Martin. So the college has had its losses and its shocks, and it's part altogether from any just kind of typical challenges that any college and any company faces. We have had there's been those two great losses of very important people who were very important to the college. And Liam, one of the founders, a very unique character, and so the scholarship is named after him. Liam and Josephine would be, I think, the kind of people who you need to start something like PCI College. I mean, I don't think I would be the kind of person who would start something like PCI College, but I'm the kind of person who then takes over at a certain point. But you need the kind of people who will just step out there into the open space, or kind of over the cliff edge in a way, and just get things started, and it's great that Josephine is still around, but Liam, at a certain stage, we lost, and he was a larger than life character, I suppose, really, and so those who knew him never forget him. Obviously, many people have associations with PCI College and never met Liam, but yeah, he was very much larger than life, and a very much a why not kind of person than a why kind of person. Martin came on board with me and was the chair of the board, and really set the strategy and direction, in discussion with all of us, and guidance from all of us. But from the business side, the business growth of the college, Martin was the driver, and unfortunately, passed away relatively suddenly. A few years, into my time with PCI College, he was a very important part of my time at PCI College, because we started together and because we were, as I say, setting out that strategy and trying to break the mold a little bit. In particular, and this is another, controversial thing in our field, though hopefully, I think getting a bit less so, particularly simply around growth. You know, I mean, to me, one of the most exciting parts of my experience of being in PCI College was expanding into, Cork and Belfast, and forming links with Iron Mill College in Exeter, and that kind of thing. That sense of, come on, let's just see what's out there, and let's just grow. Let's offer what we do, elsewhere than it was Dublin and Kilkenny. When we took over, and it's in the end of it all, it's reflected growth in the field as it happens. Those mutterings and kind of maybe, I don't know, a bit of jealousy, but yeah, those were exciting times. I think it is. There is something very exciting about saying, come on, let's see how far can we take this thing, So that was enjoyable.
Yeah, and breaking into Belfast is another big thing for PCI College, wasn't it? So again, it's that what I'm hearing is that what's possible, anything really. And I suppose we've learned that this year, particularly in the pandemic, the way people can overcome adversity and do things they never thought possible before. And I really think that's been modeled by PCI College over the 30 years, because we are leaders in the field and have made, huge strides where others looked on. And it's really a proud moment to be here and be here with you on the 30th year, Eoin. When I'm just thinking about Martin there and our discussion earlier about the standards in the college, and so it's worth saying that the recognition, the college, the legacy that Martin has left us is, beyond words, but also in the form of our Martin Kitterick Award, which is an academic award.
That's right. Yeah. Very interesting, isn't it? Yeah, that is. I was thinking about that earlier. So that's for the thesis that is deemed to be making the most contribution each year. And I think, he would have, I think, been very pleased with that idea, because again, he knew that that's what we needed to be doing. We needed to be looking forward all the time in that way, and pushing and growing and not resting on our laurels. And part of that is around academic standards and standards in general of education, which of course is a very complex thing, and growing our lecturing team was a hugely exciting part of what happened over the years, and then graduates starting to become lecturers, and graduates that had been students of mine becoming lecturers, and all those kind of key points, milestones there. And just another piece of professionalization, standards, also simply my experience of PCI College was, growth means growth in staffing, which of course means growth in the lecturing team. And as I said, that was a very exciting part of the work. Just the helping people to, move into that lecturing space if they hadn't already, and do it well, and discover how exciting it can be, I suppose I should really emphasize how much I love lecturing myself. Anyone who's seen me lecturing knows that, and I still, love to train and lecture and teach. So a huge part of my experience at PCI College is simply teaching subjects that I love to people who actually want to learn about them. It's the beauty of our education, is that the people who are there want to be there. They don't always want to write essays, but they want to be there. Outside of academic standards and general training standards, and our relationship with the IICP over the years, which has been a very powerful one, very important one, and still is, and you're very involved in that. And growth, which of course means simply growth in size and growth as a business. Another part of my experience is that all of that means growth, not just in the size of an administrative team, but in the quality of an administrative team, because the challenges become greater.
Yeah.
Running a very small organization where you know every student by name is a very different thing than running a large organization where you've got classes distributed, all around the country, and lectures distributed all around the country. So to be honest, one of the biggest challenges, and what took up a lot of my time, if you like, and my work was, being involved in that with people who were more expert than me. I think I've got some natural ability for the administrative side of things, maybe because I'm autistic, but obviously a key thing that Martin and myself had to do was bring in more, over the years, gradually bring in more trained administrators. Yeah. And of course, where that's taken us. In fact, slightly better than I do at the moment, because I'm not as much in touch with the admin team as I used to be. But it's absolutely vital, obviously, that we built up the administrative expertise at a few levels over the years, and that was, again, interesting, exciting. Didn't always work the way we wanted, and then eventually does, and took a lot of trial and review. But I think it's been a big part of what makes the running of PCI College vital, by definition, is having that good admin team. It's part of the professionalisation as well. It's like that the training students isn't something that people who are, when we talk about the word professional, we sometimes mean as distinct from amateur. You know what I mean? Like on the end of it all, you can be the world's greatest counsellor, but that doesn't mean that you're a brilliant lecturer. You've got to learn to be that. That's another profession. And it also doesn't necessarily mean that you're great at organising things, So this distribution amongst, I think, people who are expert in what they do has, it's the obvious way to go. But certainly for me, it was a big learning curve, actually, and a positive one.
Yeah, and what it's left us with, Eoin, is this really functional and quality infrastructure behind the scenes that the students might not necessarily see, but it really is the kind of the cogs that keep the wheels turning. And you're absolutely right. There is a worlds apart between good counsellor, good lecturer, good administrator, and our admin teams will definitely tell you that they're constantly supporting us to be better administrators.
Of course, you have to be all three. And
to be all three, no bother, but I learned from the best, so of course, that's no problem.
Hopefully.
So really what I'm hearing, just to sum up what we've been talking about, I suppose the themes that are popping up for me are really around transformation, professionalisation, quality, and growth. So with all of that in mind, what do you think is next for PCI College, or what would you like to see in the next 30 years?
It's a tough one in a way. I suppose I think, I'm going to partly talk obviously from my own point of view and my own things that I think are important, but then there is a good overlap with PCI College for obvious reasons there. And I think that like one of the things that I think has always been a strength of PCI College, and I think I partly influenced it, but it wouldn't be entirely my influence, is fairly good openness to a multidisciplinary kind of point of view. In other words, for instance, one of the areas that I would have influenced this to some extent, but not entirely me. It would be the role of cognitive behavioral therapy in the field and in PCI College, but particularly the things like the CPD course, our professional certificate in cognitive behavioral therapy. We always tried to make relevant to and tried to market it to psychiatric nurses, GPs, guidance counsellors, psychiatrists, life coaches, whoever else feels they might be able to make use of things like what you learn from cognitive behavioral therapy. And I think that is one piece that I think would be useful to keep in view. I don't think professions that are professional should be very separate from other relevant professions. And that's a difficult area in our field. It's difficult, not just in the counselling psychotherapy profession, but where do counsellors and psychotherapists, what's a counsellor, what's a psychotherapist, and where do they stand with psychiatrists and psychiatric nurses and coaches? And there's a lot of, self-doubt, mutual suspicion, a lot of controversy. If you take an issue, I was just teaching students there about CBT for depression, and of course, an issue that comes up is medication, is antidepressant medication, SSRIs, and people's views on that from both sides, from the more psychiatric or medical side and from the counselling and psychotherapy side, can be everything from, well, sure, why not? Whatever works for people, let's get together on it. If I'm working with somebody in the counselling setting, if medication helps, it helps. If I'm the person who's doing the prescribing, well, then if they get counselling therapy of some kind, great, and that's fine. They can do both. It ranges all the way from, very negative views around each other's professions and around something like medication. And, absolutely, people absolutely entitled to have their opinions, and we can have very interesting discussions around them in class, for instance. But I do think, I suppose what I'm talking about is in a way where some of the field needs to go. It's like going back to what we said earlier. The field needs to professionalise, therefore PCI College needs to be involved in that professionalisation. I think the field then, with the professionalisation of our field, clients need a more easy multidisciplinary sort of communication, because they don't need to be caught in that sort of space, where there's arguments about what people need, or there's, people don't want to communicate across professions, across disciplines. Another area, that I've been involved in is the whole sort of dual diagnosis problem, the way that, again, people who are struggling with an addiction can also, surprise, be struggling with another mental health problem like depression or anxiety. But, they can easily then get caught between services, So I think there's a big issue there around, if you like, growth and confidence as a profession, and then some kind of settling down of more ease of communication and respect between the professions. Maybe some of it is because we're still not quite sure of ourselves as a profession. So I certainly think that, it'll be interesting for PCI College to keep an eye on that, as again the college has done around things like supervision training. There's always been that kind of multidisciplinary openness, but I would certainly, if you like, recommend that. I think that's where some of the action will be in the future.
Wise words, very wise words. You're right in that we always have an eye on that, but there is room for more. There is room for more. And the elitism of counselling and psychotherapy.
Something like that, yeah.
All the time, yeah.
And the elitism sometimes of other professions.
Exactly. It works both ways, of course.
Yeah. And we don't need that. Clients, patients, whatever, people do not need that. They just need
you're absolutely
help,
right. And that's reminded me then, just two last thoughts. As you say that our most recent revalidation of our supervision course was done with just that in mind. And so we've expanded that to now clinical supervision to include those professionals.
I saw that, yeah, it's very good.
Yeah, and then we've actually, one of the things you did initiate as well was the establishment of a research committee in the college. And we never quite got underway during your time in terms of beginning a research project, although we were doing other research related tasks instead of that. But we have now started our first research project, and we're halfway through, and we're doing it in the area of the teaching profession. Looking at supports there, mental health awareness in the classroom, and things like that. So another example of how we're maybe moving into that territory of working with other disciplines.
Yeah, that's really interesting. Yeah, and sometimes just taking the concept of mental health and just saying, what do we all need to do? And so many professions have a role in mental health. Teachers do, counselors and psychotherapists do, psychiatrists do, GPs do. Lots of people have a role in mental health, and so I think that's this one of the spaces to watch really going forward. Yeah, and I think since it's again, now that we're talking, I think, again, COVID has highlighted mental health as an issue. It was getting highlighted anyway. I think in the time I've been a therapist, over those few decades, mental health has become more of a talked about subject. But I think COVID has pushed it another bit into the public eye, mental health concerns.
Yeah. Well, thank you, Eoin, for those musings and reflections and very wise words. As always, it's a pleasure, and I know how busy you are, and so we're very grateful for you to giving us your time today. So thank you very much.
Great. Well, look, it was very interesting to reflect like that, and
it was nice to walk down memory lane again.
Yeah.
Also, just want to again just affirm how important and instrumental you were as a person, as a professional within the college. And really PCI has been shaped by so much of your vision and your standards ultimately as well. So I just want to acknowledge that too.
Great to hear that. Thank you for those words. Thank you very much. And good luck with all the 30-year celebrations.
Yeah.
Exciting.
Okay. Great. Thanks, Eoin.
Nice talking to you. Take care of yourself.